Imagine if your body was trying to warn you about a health issue every single day, but you kept dismissing it as something minor. What if one of the most common symptoms affecting millions of Americans could be a sign that your body needs attention right now? Stay with me because today we're talking about a health concern that many people feel embarrassed to discuss, yet ignoring it can seriously affect your quality of life. Hello and welcome back to Health Diagnosis. If you're new here, make sure to subscribe and turn on notifications so you never miss our latest health and wellness updates. Today we're discussing urinary urgency, frequent urination, and bladder discomfort, issues that can impact people of all ages but are especially common among adults and seniors. Many people assume these symptoms are just a normal part of aging, but that's not always true. Have you ever felt a sudden, intense urge to urinate that seems impossible to ignore? Maybe you find yourself making frequent trips to the bathroom during the day or waking up multiple times at night. While occasional changes in bathroom habits can happen to anyone, persistent symptoms may indicate an underlying health issue that deserves attention. One possible cause is an overactive bladder. This condition occurs when the bladder muscles contract more often than they should, creating sudden urges to urinate even when the bladder isn't full. Overactive bladder can disrupt sleep, affect work performance, and reduce overall quality of life. Another common reason is a urinary tract infection, often called a UTI. UTIs can cause burning during urination, pelvic discomfort, and a frequent need to use the restroom. While they are more common in women, men can also develop urinary tract infections. For some individuals, frequent urination may be linked to diabetes. When blood sugar levels become elevated, the kidneys work harder to remove excess glucose from the bloodstream, leading to increased urine production. Excessive thirst combined with frequent urination should never be ignored. Men may experience urinary symptoms due to an enlarged prostate. As the prostate gland grows, it can place pressure on the urethra and interfere with normal urine flow. This may result in weak stream, difficulty starting urination, or the sensation that the bladder never completely empties. Certain lifestyle habits can also contribute to bladder irritation. Drinking large amounts of caffeine, energy drinks, alcohol, or sugary beverages may increase urinary frequency. Stress and anxiety can sometimes worsen symptoms as well. So how can you support better bladder health? First, stay properly hydrated. Many people mistakenly reduce water intake when experiencing urinary issues, but dehydration can actually irritate the bladder and make symptoms worse. Second, monitor your caffeine consumption. Coffee, tea, energy drinks, and some sodas can stimulate the bladder and increase urgency in sensitive individuals. Third, maintain a healthy weight. Excess body weight can place additional pressure on the bladder and pelvic floor muscles, contributing to urinary symptoms. Fourth, consider pelvic floor exercises. These exercises may help strengthen muscles that support bladder control and reduce episodes of urgency or leakage. It's also helpful to keep a bladder diary. Tracking fluid intake, bathroom visits, and symptom patterns can provide valuable information for healthcare providers and help identify potential triggers. Now let's talk about warning signs that should prompt medical attention. If you notice blood in your urine, severe pelvic pain, fever, chills, unexplained weight loss, or a sudden change in urinary habits, it's important to contact a healthcare professional as soon as possible. These symptoms may indicate conditions that require prompt evaluation. Remember, urinary symptoms are extremely common, and there is no reason to feel embarrassed about discussing them with your doctor. Early diagnosis can often lead to more effective treatment and help prevent complications. The most important takeaway from today's video is simple: don't ignore persistent urinary urgency, frequent urination, bladder discomfort, or changes in your bathroom habits. Your body communicates through symptoms, and paying attention to those signals can make a significant difference in your long-term health. Have you ever experienced any of these symptoms, or do you have questions about bladder health? Share your thoughts in the comments below. We love hearing from our viewers. If you found this video helpful, please give it a thumbs up, subscribe to Health Diagnosis, and share this video with friends and family who may benefit from this information. Thank you for watching. Stay informed, Stay healthy, and we'll see you in the next video.